Hi, Daniel.
Hello.
My name is Liddy. I am a nursing practitioner student, and I will be doing your interview as well as your physical today. How are you doing?
Doing all right. How are you?
Hold on, let me close off. Give us a little privacy.
Cool.
Okay. I'm gonna ask you a bunch of questions. Just bear with me, but we need to get this done. So, can you please tell me your name and your date of birth?
Yep. Daniel Sellen, March 6, 1986.
Okay, that makes you how old?
36.
Okay, Daniel. Who's the president of the United States right now?
President Obama. Oh, sorry. Biden.
Biden. Oh, you like Obama,
No.
huh? Okay. So who was the first president of the United States?
Was it George Washington?
Yes, I believe it was. Yes. So why are you here today?
Just an annual physical for work.
Okay. Any pain? Any discomfort?
Nope. No.
Okay.
Not really.
Let me ask you. I want you to count from 1 to 10 for me, and then I want you to do it backward.
Sure. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10, 9, 8, 7, 6, 4, 5, 3, 2, 1.
Okay, I'm going to give you a couple of words, and as we continue, I'm going to ask you the words again. Okay? I'm going to ask you for the color red,
Okay.
an apple,
Yep.
and a dog.
Okay.
Okay. When was the last time you saw your doctor?
I think about the same time last year.
Okay, great. So, so far, I see that you are alert, you are oriented times 4.
Okay.
You know who you are, you know where you are, you know the time of day, you know which year it is, so if you know what situation you're in right now. Okay, so you're doing great with that. What I'm going to do is do some vital signs on you before we start, so we have a baseline to work with, okay?
Understood.
So, stethoscope. Let me have your arm, please. Any history of high blood pressure?
No.
Family history?
Not that I'm aware of. I'm only familiar with my immediate family.
All right.
So.
Thank you.
Mhm.
Mm-hmm. 122/74. You're doing great. Okay. I am going to take your pulse, if you don't mind. 82. Good. I've been watching your respiration. It's even. There don't seem to be any distress. Okay. So we have your respiration at 18. All right. So we've done your blood pressure, and we're going to do your temperature. 98.8. Doing good. Great. No fever. That's good.
Nope.
Taking all of your vaccinations, your flu shots, everything.
Yeah.
Okay. Great. COVID shot.
A booster, yeah.
Okay.
I don't know how I feel about more, but yeah.
Take your booster.
Right.
Basically what I was wearing now. Okay, so now I'm going to start your physical, which means I'm going to touch your hair. May I?
Sure.
Okay. Your hair texture is appropriate for ethnicity. Your scalp is clean. I don't see any dandruff or any lice. No masses. Any tenderness?
Yep.
Okay. There is no areas that's missing any hair. Okay, we're good with that. The head is normocephalic, which means that it's appropriate size for your body, actually. All right. On your skin, warm to touch. Okay. Turgor's good. I don't see any blemishes. Even in your beard line is fine. There is no bumps. You just have a little birthmark right here. Okay. Other than that, everything seems fine. Your eyebrows are symmetrical. Okay. Your eyelids are symmetrical. Your eyelashes are full. Your eyebrows are full. I'm not seeing any pieces or any area that's missing any hair there. So we're going to look into your eyes, all right? We are going to look in the conjunctiva, and it's nice and pink. Your sclera is white. That means I don't have to worry about jaundice, all right? We're going to look at your canthus, okay? I don't see any crustacean. Your lacrimal ducts are not overflowing. We're going to look at the iris. We're going to look at the pupil. Okay, so at some point I'm going to be having some lights in your eyes.
Sure.
I need to look in the back of your eyes.
Sure.
I need to make sure that the retinal vessels are there. Okay, what some people would call a red reflex.
Okay.
Okay, I have to look at that. I have to look at lacrimal red reflex, opacity.
Okay.
Of your eyes, okay? We just want to make sure that your eyes is working right. But one of the things that I'm going to do is check to see if you're able to use your eyes properly for reading.
Okay.
So we're going to talk about certain nerves, okay? So your eyes are actually optic nerve number 2.
Okay.
And that I'm going to do what's called a Snellen chart. You put that about 14 inches from your face.
Okay.
And what I'm going to ask you to do is cover one eye. And I'm going to have you read for me. Can you read the last line?
LTFPH.
Okay, what color is this?
Green.
What color is this?
Red.
Okay, switch eyes, please. And tell me, read the same line again.
LTFPH.
And tell me which color is this?
Red.
And what color is this?
Green.
Okay, great. That tells me you have 20/20 vision. Your vision is fine. Now, we're going to look into the eye. All right? Okay, all right. Now, I'm going to get very up close and personal. So, bear with me. I see the red reflex. I don't see any opacity. I see the veins. They are fine. I don't see any cloudiness. Okay, great, great. We normally would do both eyes, but because we're trying to save time, okay, so we're only doing one today. For the video's purpose. This is a teaching video. All right. You have no problem with them. They're not dry. They're not burning, as far as I can see. Okay. Your conjunctiva is fine. They're not, dry. They're not anything. So we're good with that. All right. Now we've done that. I am going to try your temporal artery. I want to see the pulse. It's fine. It's not bounding. Great. I'm going to look at, this is we've done 2. We're going to do your nose. All right. Which is actually 1. Can you have any problem breathing?
No.
Any problem with sinuses?
No.
So we're going to check your sinuses, your temporal sinuses. Any pain?
No.
Okay. Your mandibular? Any? Okay, great. Now we're going to, normally I would have you close off one nose and breathe something.
Right.
And tell me what it is. But as you said, there's no problem with your breathing.
Right.
We'll leave that alone. Okay. So what we're going to do is I'm going to look inside your nose. I'm going to look for polyps. I'm going to look for redness. I'm going to look for deviated septums, perforation, anything that is not normal, for dryness. The cilia is a little hair that catches things like that. All right. So I want you to know what we're doing before we do it. Okay. There's no discharge. There's no runny nose. I can see the cilias. I can see there's no deviated septums. I don't see any polyps or lesions. Okay, the walls are nice and pink. You're doing good.
Good.
All right, great. We're going to check your ears. All right, that is cranial nerve number 8. And with that cranial nerve, there's a lot of things to do. First of all, let's take a look at your ears. There are no masses, there are no lesions, there are no red marks, no bumps, nothing. Your ears is fine. We're going to look inside the ear. And let me just switch pieces. Okay. When I look inside your ear, I'm going to be looking for the cone of light. Okay. If it's on the right side, which this is going to be the left, so which means I will be looking for it at 7 o'clock.
Okay.
Had it been on your right side, I'd be looking for 5 o'clock.
Okay.
I am going to be looking for issues with redness, if your tympanic membrane is perforated or not. Okay?
Okay.
All right. Because you're an adult, I'm going to pull your ear up and back. If you were a child, I would be putting it down and back. Okay? I see a little bit of cerumen, which is normal. I see the celiac, which is normal. I see a tympanic membrane, which is intact, no perforation noted. Your tympanic membrane is a little bit like a light silvery gray. Okay, it is intact. It is nothing wrong with it. It's the way it's supposed to look.
Good.
Okay, all right. You know what I forgot?
What's that?
I needed to do some additional tests to your eyes. For some reason, I was just nothing.
Mesmerized.
Mesmerized. So what I need you to do for
Yep.
me is I'm going to have you look at an object, all right?
Okay.
We're going to look for something called convergence.
Right.
Okay, so what happened is I'm going to bring this to you and I want you to look at it directly. Look at my nose and look at this directly. It's coming at you.
Okay.
Let me know when it's blurry.
Okay.
Okay?
No.
Okay.
Okay.
Okay. Now, there's something called the cardinal sign.
Okay.
All right? And it's 6 points. And I need you to be able to follow my finger.
Right.
All right? Keep your head straight. Just let your eyes follow the finger and the way it goes. Okay? Okay, great. This thing with your eyes, what you need to know is that we are working in different nerves. So that's actually nerve 3, 4, and 6. We're looking to see your ocular motor, if your eyes is able to turn around and do avernacida, your trochlear, which is 4, if it's moving your eyes up and down, and the abducent, which allows it to go laterally. And so far, all of these are working out. Okay.
Beautiful.
I do have to do one more test though with your eyes. And I'm going to check to make sure that you have your eyes, cover one eye, okay? No, that's not what I need to do. I need to look into your eyes to see how the pupillary reaction on the other one. Because so far your eyes are pearl. They react to light. I'm aware of that. But I want to check that one.
Sure.
Okay. What I was checking is making sure that it's like there's an equal response on the other eye. As I put too much light in one, the other one will constrict also. Okay?
Gotcha.
So, and I was able to get that out of there.
Okay.
Okay, great. So we've done your ears. Okay? We are not finished with your ears because we have to do the Weber and the Ryan test. Okay?
Okay.
All right. So what that test does is I want to be able to know how your ears are hearing sound, if there's any blockage or any difficulty in hearing.
Understood.
All right? So tell me when the vibration stops.
Yep.
Okay. Did you hear it in both ears the same way?
Yep.
Okay.
Stop both in the same,
All
at
right.
the same time.
So now we're going to do what's called a Ryan test. I'm going to put this in your occiput in the back here, and then I'm going to put it to your ear. I need you to tell me at the end which side you heard the longest.
Okay.
Okay? Tell me when it stops.
Yep. Yep.
Okay. All right. So that's telling me you don't have any problem with your disorder, hearing loss, or anything like that. So we're good with that. So we've done your eyes, we've done your nose, we've done your ears. We're gonna do your lips and your mouth. Your lips is not dry. There is no bumps or anything near it. It's not cracked. It looks like it's moist. All right. I'm gonna ask you to do me a favor. Open up your mouth. Okay. Now your mouth. There's a couple of things going on. your mouth is, we're going to, first of all, give me a big Kool-Aid smile. That's number 7. That's nerve number 7. Open up your eyes. Close it. Let me try to pull them up. Yeah. Okay. That's good. Blow out for me like a blowfish. All right. So that nerve is working out. Just your facial nerve. All right. With that facial nerve, okay. With that facial nerve, I need you to close your eyes, and I'm gonna touch your face with some things. I need you to tell me if it's soft or if it's sharp.
Sure.
Okay.
Soft. Sharp. Soft. Sharp. Soft. Sharp.
Okay, great. It tells me that everything is working as it's supposed to. Now for your mouth, I need you to go out. We're going to do, before you do it, we're going to do your nerve number 9, 10, 12. Okay? All right? Because we did 5, which is your trigeminal. We did your 7, which is your facial. So we're going to do 9, which is a hypopharyngeal. Right? And we're going to do the 10 vagus, and we're going to do that is going to be where your tongue works. Okay, your 12 is the hypoglossal. Okay, all right, so open up. I'm looking at your tongue. It would make more sense this way, right? Okay, I'm looking at your tongue. Your uvula is in the back of your throat. It is midline. I don't see any redness. Okay, I'm looking at the side of your cheek. It is nice and pink. I don't see any lesions. I don't see any broken skin around it. Your dentition is good. You don't have any cavities. The palate soft and hard and tack and pink. Okay, stick your tongue out. Move it side to side for me. Yes, lift it up for me. I want to see underneath it. Okay, I don't see your tonsils in the back. Did you have them removed?
Yeah.
Okay, I don't see any exudate, nor do I see any nasal drip. So your throat is doing well. Okay. I'm going to go and check your neck. Okay? Okay? We palpate first. All right, your skin is fine. What I'm going to do is I am going to check your vagus nerve, which means I'm going to allow you to drink something.
Okay.
All right. 9 and 10. Those are some of the nerves that deals with swallowing.
Okay.
Okay. All right.
Bring that to my water over there.
This works out. Okay. Hold on, please. Okay. While I am going to do the swallowing test on you, I'm also going to check your thyroid.
Okay.
Okay. All right. So go ahead, drink. Palpating your thyroid. They're symmetrical. I don't feel any nodes. Any tenderness?
Nope.
Okay. Any problem? You have ever had any problem swallowing before?
No.
Okay. Great. So now we're going to go into your cardiac. Okay. Before we do anything, I generally need to check your chest. All right? So, because of the video, we're going to keep your clothes on. But generally, we do this without a shirt on and patient. Okay? We look, we inspect, we make sure that the skin doesn't have any lesions, any mass, any bumps, any scars, any cuts, anything abnormal. Then we palpate. Okay? All right? Any discomfort, any tenderness?
Nope.
Okay. Now, we're going to do your cardiac markers. All right? So what I'm going to do is I'm going to listen to your heart sounds. All right? So on your left side, second intercostal, doing the first and second intercostal, that's your aortic. So I'm going to listen with the diaphragm. Just breathe normally for me. And then I'm doing the bell. Okay, it is near the sternal border. I'm doing on the other side of the same, between 1 and 2, for your pulmonic. Now, breathe. Just breathe normally. Okay, then we go to Erbswint, which is 3, and we do the same thing. Then we go to 4, which is your tricuspid, which we do the same thing. Then I need you to 5, which is your mitral, which is the mid-clavicular line. I need you to breathe. I need you to lean forward a little bit like a 30, yes. And breathe again. Hold it. Breathe. Okay, thank you very much. So far everything is intact that we've gone over. I don't see any major problems with the areas that we have already covered. Okay, now I'm going to go into your back because I need to check your back. Okay, a couple of things we're gonna do. I'm gonna check your back. After I check your back, I'm gonna have you lean back because I need to check your jugular vein and your carotid artery and your neck. Okay. Actually, let's do that first.
Okay.
Lean back a little bit. About 30 degrees. Because of the space we have, just assuming he's at 30 degrees, okay? Okay, so we're going to check his jugular vein for any distension, any bruits. We're going to palpate first, okay? Then we're going to check the carotid. Okay? And what you do with the carotid, you check both sides, but if you press on both of them at the same time, you may have the person pass out, so you kind of want to do one at a time. All right? And then you, of course, scrotate. No bruits. No tenderness. Oh, that's good. Now let's see your back. All right. Like everything else in your back, first thing you do is you're going to check the skin. You will check to make sure that you inspect it, that you have no cuts, no bruises, no area that are raised, you know, just even distribution of skin. Okay. Okay, so we look at it. Everything is symmetrical. It should be. There is no issues with his skin that I can see. All right. He has a couple of little freckles, but other than that, everything else is fine. Thank you. Okay. Now what we're going to do is we're going between the first and second intercostal space. We're going to check for bronchovesicular sounds. Okay. After that, everything else is vesicular sounds. Okay, we are going to definitely palpate. We should have done that already, actually. Okay, no tenderness, no pain, no discomfort, right? No. Okay, now we're going to look out for the diaphragmatic excursion.
Okay.
Okay, so what I'm going to do is I'm going to go out to your floating ribs at the back. Okay, I'm going to start to percuss from under here down till I get a dull sound. And what I'm going to do is I'm going to have you breathe for me. You're going to breathe 3 times. Hold up. I want you to breathe 3 times. On the 3rd time, hold it. Okay? And then I'm going to do it. And after I mark it, you're going to let it out. And then I'm going to have you to breathe 3 more times. And I'm going to ask you to let it go. And I'm going to do it backwards. And the difference will tell me what your diaphragmatic excursion is. All right, my dear?
Yep.
All right, great. Go ahead, breathe. Okay, that's dull. It's a different sound. So we mark it there. Let go. Okay? Now I want you to take 3 deep breaths and let it out the 3rd one. 2. Okay, so now we're doing it backwards. Okay. The difference in the sound is about 4 centimeters, okay, which is normal. Okay, 4 to 6 centimeters is normal. Actually, some people may have even 8 if they're very active, very sportive.
Okay.
So, and that would still be normal. That means that is fine.
Okay.
So now we are going to check for your costovertebral angle, which is I'm checking for tenderness in your kidney.
Okay.
All right. So, any tenderness, any pain?
Nope.
Any tenderness, any pain?
No.
No. Okay. So, we're going to check for the AP, lateral diameter.
Okay.
Okay. So, look at it. Okay. It's 2 to 1.
Okay.
All right. And I want to check your back. I want to have my fingers in your middle of your back, both hands up. I want to see your chest expansion. Go ahead. It's about 1 inch apart, which is fine. So all that is okay. All right. Now I need you to lie down for me. I am going to check your stomach area.
Okay.
Okay. We're going to check for bowel sounds. When was the last time you went to the bathroom?
Last night.
Okay. Everything is okay with that? No diarrhea, no constipation, nothing I need to know.
No.
Okay,
That's good.
great. So what we usually do is when we're checking for bowel sound, we split the stomach into 4 quarters. We have a lower right quadrant, upper right quadrant, upper left quadrant, upper left lower left quadrant. And I'm gonna go around in circles. So what I want to do is that when I check it, and which I'll be using my stethoscope to check it. When I do it, I want to hear between 5 and 30 sounds. If I don't hear any sounds as I do it, then I have to do it for at least 5 minutes because something is wrong. All right? So here we go. Okay, now I'm going to palpate your stomach. I'm going to palpate your stomach about 2 inches down, and I'm just a little massage, circular motion. Any tenderness? Any pain? That's light, by the way. We're going to do the deeper one in a few minutes. Okay. Now I'm going to do it a little deeper.
Okay.
So it's going to go about 4 inches down, 4 centimeters down, I'm sorry. Any pain? Any discomfort?
Nope.
Okay, I'm not feeling any masses or any issues. Okay, now we have your aortic artery, which is about 1 inch underneath your xiphoid process.
Okay.
We're going to check for that. After that, we're going to do your renal. So I measure it underneath the xiphoid process, about 1 inch or so, and then I listen for it. I'm not hearing any bruits or any other movements. Your renal, which is about on each side of your umbilical cord, umbilicus, which is about 3 centimeters off. Okay, on both sides. So we look for the right and the left. Okay. After that, we will check for the iliac.
Yeah.
Okay, so which is actually about 1 inch underneath your umbilicus, and to the left or the right about 3. So here's your umbilicus. We go down here sideways. You can measure that with your fingers, okay, just to be safe. Okay, everything seemed to come back fine. We have your spleen, and we have your spleen and your liver, okay, which we're going to measure. Okay, we're going to check for tenderness in your liver space. Any pain, any discomfort. Okay, this is the right side, so we're checking for the liver. Okay, then we're going to check for the spleen on the left side. Upper quadrant of the abdomen. No pain? No discomfort?
No.
Okay, great. This is good. Thank you. I need to help you?
No.
Okay, great. All right. So now what we're going to work on is your strength. Okay, we're going to check for your reflexes, and then we're going to check for your strength. So let me have your arm. Okay, here's what we're going to do. Tell me if anything goes wrong, just let me know, okay?
Okay.
Okay, we're going to do your tricep.
Okay.
Bicep. Very good. Okay, any problem there?
No.
Okay, I need your knees.
No.
Okay, I got a nice little knee-jerk reaction with that. Okay, I am going to look at your radial artery, your brachial artery, your radial artery, your femoral artery, which is in your groin area, your popliteal, which is the back of your knees. Okay, a lot of people don't realize they can have a lot of problem in the back of their knees, especially if they're drivers with big cysts. All right, we're looking for the tibial posterior pulse. It's there, and then we have the dorsalis pedis, which is on top of your foot, and it is there. We're going to also do the Babinski as long as we're on your foot. So reflexes. All right. Okay, 1, 2, 3, here we go. Oh, okay, you got a nice flare up. Had you been a baby, it would actually would have curled up. So that's good. Now we're going to do, hold on please. That nurse just stopped by and got that door cracked. Okay, now I want to check your hands. Okay. Dip, PIP, MCP. No swollen nodes. Okay. Any difficulty with your hands? Okay, here's what I want you to do. Take my hands. Okay. Ow, you've got some serious strength in there. I also want to see some flexion and extension. Flex. I'm going to pull you.
Okay.
Don't let me pull you.
No.
Good. Okay, now I'm going to push. Very good upper muscle strength. Put up your hands up in the air and act like you just don't care. All right. Okay, any pain and discomfort?
No.
Okay, do me a favor. Put your arm back like this. Lean over forward. Any pain that way?
No.
All right. Put your hands behind your head. Lean back. Any problems?
No.
Okay. Your head back. Extend to your chest. Look to the left. Look to the right. Any pain, tenderness, or discomfort in that?
No.
Okay. Your nerve number 11 now I am going to test.
Okay.
So let me have your shoulders. Put it up, please. Push up. Yes. Wow. Okay. All right. So we're going to have you do stand up, please. Okay. Okay. What I want you to do is I want you to twist your body this way and then that way. Any discomfort? Okay. Would you bend forward, please? I want to check your spine. Oh, I need to be able to see you. Okay. Bend forward. Okay. There is no curvature in your spine. Okay. No, nothing. Okay. Any discomfort there? No. Okay. Great. Your hips seem to be symmetrical. Okay. Your shoulders are symmetrical. Okay. All right. There is no issues in the back of your neck, your spine that I can see. I need you to stand back, please. Okay. I need you to point, which means I want you to flex. I want you to extend and flex your feet. Yes. That's it. That's working well. Okay. I want you, while you're standing, to go on one feet. I want you to pass your heel on your shin, up and down. Okay, great. Switch, please. Okay. All right. Do me a favor. Bend your knees and bring it up. Okay. Any discomfort? Put it down. The other one. Put it down. Any problems there? I need you to close your eyes and keep your hands on your side. Remember, I want to just see how you balance yourself. Okay? All right? Okay. I want you to walk towards me, one foot, the toes of, yes, just like that. Is it the drunk test? Yes. Okay. You seem to be, turn around. I want you to walk on your heel. Yes. Stop. walk, continue to walk on your tippy toe. Yes. Great, great. All right. I need you to lift your knee up, move it towards the other leg. Yes. Abduct, turn it down, bring it down. Do the other one. Okay. Abduct towards the center. Yes, yes, yes. So far, I'm not seeing any problem. It'll be very easy for me to write you a physical form. Okay? And you would have passed pretty much everything. Thank you so much for your time.